Hello, welcome back. Today's video topic is about gallbladder cancer. Like any other organ, gallbladder also can get cancer. How common is gallbladder cancer? It's very rare. Okay, in this video, we are going to see what are the causes, what are the high risk, and is it preventable? All these things we will see. As you know, like everybody knows about the gallbladder. Gallbladder is like a 3 to 4 inch size bag attached to the liver, and it's protected by our right side ribs. So the function of the gallbladder is pumping, especially pumping the concentrated bile. It concentrates the bile and pumps when it's needed. So can it get cancer? Yes. What are the high risk? What are the high risks for the cancer, gallbladder cancer? The first and foremost we can say is the age. Anyone above 70 years can get, it's very common after 70 years, and it's more common in female sex. Females are more affected 3 to 4 times more than the male. And ethnicity wise, if you see, Indians, Asians are more prone to gallbladder cancer compared to the Western population. And those who are obese, the risk factor is very high. Even the previous videos we have explained about the obesity and the reasons for the cancer. So obesity is one of the major reasons nowadays for the gallbladder cancer. And smoking, again, it's a preventable thing. So obesity and smoking are preventable. Smoking is another one reason. And alcohol and any stone formation in the gallbladder. Most of the doctors or most of the scientists, they don't accept gallbladder stone causing cancer, but most of the time, if you see, 80% of the time, people when come with the gallbladder cancer, they have a stone. So what the theory is, the stone will not cause cancer, but the stone causes inflammation in the lining epithelium of the gallbladder, causing or turning into a cancer. So gallstone can instigate or promote the cancer formation. And one more thing is porcelain gallbladder. The porcelain gallbladder is nothing but the full complete inner lining of the gallbladder is coated with cholesterol stones. So the gallbladder becomes a stony, hard, dilated gallbladder. So these patients have more chances of getting gallbladder stones, gallbladder cancer. And other reasons being gallbladder polyp. So not all polyps can cause gallbladder cancer. Again, per se, gallbladder cancer itself is very rare. So suppose somebody has a gallbladder polyp with more than 1 centimeter, the chances is very high. And suppose they have a problem in the bile duct, the outlet of the gallbladder. Suppose a congenital formation or cyst formation, this is called colorectal cyst. Because of this colorectal cyst, the stasis of the bile causing gallbladder cancer. Sometimes bile reflux, instead of going into the small intestine, the bile reflux is there. This can leads into gallbladder cancer. Primary sclerosing cholangitis is nothing but infection of the bile duct. The severe infection, it's a cholangitis, an infection of the bile duct leading to scarring of the bile duct, leading to cancer. And family history, again, the family history is also very important. This can also, and people who are working in the textile industry, rubber industry, because of the exposure to the chemical, they can get gallbladder stone. Okay, is it preventable? Or is there any way to prevent the gallbladder cancer formation? And if you ask the question, you can say blindly no, but definitely we can at least take an effort to prevent it by avoiding smoking, alcohol, and very importantly, weight. Obesity, if you lose weight, the chances of cancer is very less. And avoiding deep fried food and eating more vegetables and fruits can prevent any cancer for that matter. Okay. And what are the type of cancer you can get in the gallbladder? Mostly 80% of the time it is the adenocarcinoma. Adenocarcinoma is nothing but the columnar lining, columnar cells. Okay, that is the origin. There are other types, sarcomas are there, squamous type is there, but very common is adenocarcinoma. Okay, what are the causes? Okay, I have a high risk, or somebody has a high risk, Why this cancer, what is the reason for the cancer transformation? It's mainly because of inflammation in the lining epithelium of the gallbladder. Okay, that is first thing. Second is stasis, bile stasis. Suppose you have a gallstone and the gallbladder cannot pump out the bile efficiently, so there is a stasis of the bile, or even sometimes congenital cyst, there is a stasis. So stasis also one reason. The other reason is as bile reflux, the reverse way, instead of going into the small intestine, the bile is reflux backwards, causing cancer formation. Okay, what are the signs and symptoms of gallbladder cancer? There is nothing specific for the gallbladder cancer signs and symptoms. It usually presents as like abdominal pain. Like suppose you have a gallbladder stone, they are also pain. The same way you may get, but usually most of the gallbladder cancers are diagnosed in the very late stage, usually stage 3. So that by that time they develop swelling or lump in the abdomen, pain, jaundice. Jaundice is a very important sign, and they may get nausea, vomiting, and like any general cancer, they may have a loss of weight, loss of appetite, asthenia. All these things can happen with gallbladder cancer. Okay, how it's been diagnosed? Like as I said, is it preventable? If you ask the question, no. Most of the time it is presenting only in the late stage. Prevention is only by marginally, like any other cancer. Okay, how it is diagnosed? Suppose you have people present with some pain, abdomen or lump in the abdomen. They go to the doctor, they examine, and he will ask certain history, like family history, obesity, like alcohol, smoking, exposure to chemicals. All these things can lead to to suspect. You cannot diagnose directly most of the time, but you can suspect this could be a reason. So accordingly, they will ask for some blood tests and other investigations. Usually blood tests not useful because there is no direct blood test to say it's a gallbladder cancer. And mostly any screening test, like for the CE antigen, CA19-9, if they are elevated very high, probably we have to suspect gallbladder cancer. But these are all elevated even in other cancers like colon cancer. So they are not specific. Okay, and then most of the time the doctor will ask for other further tests like ultrasound abdomen, CT scan, MRI, even sometimes PET CT to diagnose as well as the stage of the cancer. And sometimes they may even do a biopsy to confirm and to see what type of cancer, all these things. They may even do a biopsy. Okay, so once this is over, then come to what is the staging of the cancer. So like any other cancer, stage 0, 1, 2, 3, 4. The 5 stages are. Stage 0 is carcinoma in situ. It's very early cancer. It's generally it's very difficult to see patients in stage 0, but the prognosis is very good. So stage 0, 1 and all, the prognosis is very good, and stage 4 the prognosis is very bad. Usually the 5-year survival for the stage 1 is 65% to 70%, and as it goes the prognosis drops. And also it depends upon the grade of the tumor, and grade 1, 2, 3. Grade 1 is very simple. Grade 3 is an aggressive tumor, so the prognosis is very poor. Usually the staging and all these things are done by the TNM classifications, tumor size, nodes and metastasis kind of thing. And what is the treatment? Treatment is, first is it has to be surgically removed, either simple gallbladder cholecystectomy or extended cholecystectomy, or sometimes even the part of the liver is also resected out if previously we know before the surgery itself, if you know it's a cancer, probably this can be done. And most of the time it's an incidental finding after the gallbladder surgery, and the pathological findings with the TNM classification, the stage, grade, then the treatment starts. Most of the people may require chemotherapy according to the age, according to the disease and stages. And again to say what are is it preventable? Generally there is no specific thing to prevent the gallbladder disease, but as a general rule, obesity and smoking are the first thing, because these are preventable one. So obesity, quitting smoking and alcohol is very that itself will reduce the chances of gallbladder stone. And of course, avoiding deep fried items, increasing fruits and vegetables can prevent the gallbladder cancer, or for that matter any other cancer. And so if you have any abdominal pain or gallstone, definitely you go to the or even jaundice. Even the previous videos we were told jaundice is not a disease, it's only a symptom of some other disease. So if you have a jaundice or if you have abdominal pain or lump, go to the doctor immediately, get yourself examined, get yourself investigated, and accordingly get the treatment. Thank you.